I am here today with our Health Commissioner, Dr. Jaraja, and representatives from every hospital in the city of Baltimore. Dr. David Marcosi from the University of Maryland Medical System, Dr. Kevin Sowers from Johns Hopkins Medicine, Dr. Bradley Chambers from MedStar Health, Rebecca Atman from LifeBridge Health, Ed Laverne from St. Agnes Hospital, Dr. Richard Katz from Mount Washington Pediatric Hospital, Dr. Bradley Schlager from Kennedy Krieger, and a return to City Hall press conferences for Mr. Christopher Thomas Cuddy from Mercy Medical Center. This group has been incredibly valuable partners in our battle against this ongoing pandemic, and as we have focused on leading a focus on the public health of our community. I want to thank everyone who's played a part in ensuring the health and safety of our residents. Baltimore's grit, resilience, and commitment to science has been recognized time and time again across the nation for how we have dealt with this pandemic. With the holidays coming up and the highly infectious Omicron variant spreading quickly throughout the country, it is critically important that we use this opportunity to urge caution and alert all of us to how real COVID still is. I want to urge everyone to get their booster shot and make sure that you get your children 5 years or older vaccinated. Again, if you were vaccinated, get your booster and make sure that you get your young people vaccinated. This is also a reminder that if you haven't already done so, get your vaccine. It will keep you healthy. It will keep you alive. It will keep you out of our overcrowding hospitals. It will keep you off a ventilator. You can find more information about free vaccinations at covax.baltimorecity.gov. That's covax.baltimorecity.gov. We are seeing the start of a winter surge similar to what we saw last year. Again, if you're going to be traveling, which you probably shouldn't, make sure you get tested before and after your holiday gatherings and travel. We all want to be with our loved ones for the holidays, but it is crucial that we do not endanger those we hold dear in our hearts and those in our communities as a whole. The Baltimore City Health Department has been providing at-home testing kits so that we can ensure equitable access to the resources needed to make smart and informed decisions. We will continue to follow the science and take appropriate measures to ensure the safety of our employees and the residents that they serve. I have asked Dr. Jaraja to put together a recommendation for a vaccine passport here in Baltimore, and we look forward to sharing more information on that in the near future. And we are following the signs to determine how we take further steps to protect our city workforce, including the promotion of virtual and hybrid work schedules. And in light of the data and the spread that we're seeing right now, I have also made a decision to suspend Baltimore City Recreation and Parks run sports programming through January 31st. Let me be very clear. We are experiencing high community transmission, and we have to do everything in our power, not just as the government and healthcare providers, but as a community to protect our residents, especially those at risk of severe illness. Since the Maryland coronavirus dashboard came back online Monday, we have been looking at indicators that suggest we are entering a new wave of infections here in Baltimore. The issues with the state database have made it difficult to track the specific spread in Baltimore. For example, we have not had information about cases, deaths, testing, or vaccinations specific to the city since December 3rd. But what we do know is that hospitalizations are up significantly over the past few weeks, which is an alarming sign for all of us. And I'll now turn it over to Dr. Jaraja to go into more depth about our current metrics, provide updates on Omicron, as well as talk briefly about our home testing pilot. Dr. D?
Good morning, and thank you, Mayor Scott, for your continued leadership. I'd also like to thank all of our hospital partners here today. I want to especially thank our frontline healthcare workers. Many of you have been in the fight against COVID-19 since March 2020, and I personally appreciate your dedication to this work and your commitment to protect the health of city residents. I'll begin by reviewing our COVID-19 hospitalization data. Due to a MDH data breach, we currently have limited access to COVID-19 case data and percent positivity at the jurisdictional level. However, the trends being seen in hospitalizations are very concerning for the beginning of a winter surge. As of December 21st, hospitals are at 90% capacity in the ICU and 88% capacity in the acute care units. The number of hospitalizations we are seeing, along with some preliminary case data from MDH, indicates we may be seeing more cases now than last year at this time. For additional reference, on November 20th, there were 107 hospital admissions in city hospitals attributable to COVID-19. As of December 20th, there were 306 hospital admissions attributable to COVID-19. This is a 185% increase over the past 4 weeks. What we are seeing stresses the importance of being up to date on your vaccinations. The COVID-19 vaccine remains the best public health measure we have to protect people from COVID-19, slow disease transmission, and reduce the likelihood of new variants emerging. If you haven't gotten your first dose, please get it. Our previous hospitalization data still indicates the majority of those admitted are unvaccinated. If you are due for your second dose, get it. Completion of the series is required to get adequate immunity. And lastly, if you're eligible for a booster, get it immediately. We know that the immunity gained from the vaccination series decreases over time, and getting that booster dose helps to bolster our immune system's ability to fight off COVID-19. As a reminder, everyone over the age of 16 is now eligible to receive a booster, and our 5 to 11-year-olds are also now eligible to get the 2-dose vaccination series from Pfizer. Please go to our website to learn more about where you can get vaccinated, covax.baltimorecity.gov. I know many are also concerned about the implications of the Omicron variant. I want to start by saying we are learning more and more about the Omicron variant every day. What we do know is that the Omicron variant spreads quicker or more easily from person to person, and per the CDC, the Omicron variant is now the dominant COVID-19 variant here in the U.S. We also know that the Omicron variant seems to decrease the efficacy of the vaccine in preventing COVID-19 infections. However, getting both doses of the mRNA vaccines and the boosters still seems to help reduce the risk of being hospitalized, having severe illness, or dying from COVID-19, even if you do get the Omicron variant. There are some reports that disease severity from Omicron may be similar to the Delta variant, with vaccinated individuals potentially having milder cases. Unfortunately, however, even if you're vaccinated, you can still pass COVID on to others. It is anticipated that hospitalizations will increase because more people can contract the Omicron variant, resulting in some of our most vulnerable populations being hospitalized. I want to be clear that although vaccinated individuals can still get infected with COVID-19, the majority of individuals being hospitalized and dying from COVID-19 are unvaccinated. According to the CDC, unvaccinated people are 6 times more likely to test positive than those that are vaccinated, 9 times more likely to be hospitalized, and 14 times more likely to die from COVID-related complications. The key takeaway here is that vaccines dramatically decrease your chances of severe illness, hospitalization, or death from COVID-19. The increases in hospitalizations are already straining our healthcare system, as I'm sure my colleagues here today will attest. What is also concerning is that if we saturate our healthcare systems with COVID-19 patients, there is less ability to care for people with other serious illnesses that require hospitalization. So what does this all mean for Baltimore City? Because the Omicron variant spreads more quickly, we expect there to be an intense phase of rapid virus spread that will require all of us to be more vigilant so that we don't overwhelm our hospitals, we decrease infection rates, we decrease risk of severe disease and subsequent hospitalizations. We do this as a community by getting vaccinated, getting boosted, getting tested, staying masked, and staying distant. While getting vaccinated remains an important tool in our tool belt to help fight this pandemic, testing and contact tracing is also critical to limiting transmission. As such, the health department has recently launched an at-home testing program. We are distributing test kits via several mechanisms with a focus on equity throughout the city. We are particularly focused on increasing access and availability to our marginalized populations, our communities that have been disproportionately impacted by COVID, and those at higher risk of COVID. To date, we have received over 11,000 test kits from the Maryland Department of Health. We have distributed those to 54 community-based organizations, our libraries, some of our vaccination and testing sites, our syringe exchange program, and our homebound vaccination program. We are prioritizing organizations that serve our value communities, or those communities, again, disproportionately impacted by COVID, or those at communities that are in zip codes with the lowest vaccination rates. Entities interested in signing up for test kits as they become available can go to coronavirus.baltimorecity.gov and click on where to get tested for COVID-19 and select COVID-19 Rapid Test Kit Distribution Program for more information. We have also added Mondays as an additional testing day, and we are in discussions on how we can further expand testing with our current resources. The screening testing being done within our schools is also an important tool in helping us identify pediatric cases and possible exposures. If you are a parent or a caregiver of a Baltimore City public school student and have not yet consented your child to be tested by city schools, please do so upon return to schools in January. If you have a child in older grades, please encourage them to complete their weekly testing. Like other jurisdictions across the state and some parts of the country, demand for testing is currently exceeding supply. We're working to expand capacity, but we ask that you be patient at our testing sites. We're distributing the limited supply of test kits we get from MDH as quickly as we can once we receive them. Testing remains one of the key components to addressing COVID and ending the pandemic, along with vaccination, contact tracing, wearing masks, and socially distancing, which are all important in reducing COVID-19 transmission. It's especially important to get tested this holiday season as travel and family gatherings increase. Please get tested to protect those you love and ensure that you aren't passing COVID on to others. This is particularly important if you're sick with symptoms of COVID. It can be impossible to tell the difference between the flu, a common cold, and COVID, as many of the symptoms overlap. We recommend getting tested to know for sure. With holidays just around the corner and cases increasing, we must all remain vigilant to protect our loved ones who can't get vaccinated or who aren't yet fully vaccinated. Again, if you're eligible to get vaccinated or due for your second dose or booster, get it immediately. We recommend that all eligible residents also get their flu vaccine ahead of holiday plans. And as a reminder, the flu and COVID vaccines can be given at the same time. When it comes to holiday gatherings, outdoors is still safer than indoors. During the holiday season, continue to avoid crowded, poorly ventilated spaces, and I strongly discourage attending any large gatherings during this time of high community transmission. If you are sick or have symptoms, don't host or attend a gathering. Get tested if you have symptoms or if you've been in close contact with someone with symptoms. And please make sure to adhere to the quarantine and isolation guidance. Please stay away from others if you are awaiting test results and immediately isolate yourself if you are positive. These measures help prevent the spread of COVID-19. Again, one of the most effective ways to prevent transmission during the holidays, and certainly the most effective way to reduce the risk of severe outcomes from COVID-19, remains being up to date on your vaccinations, including getting your booster. So please take the time now to get your first shot, second shot, or booster as soon as possible. Thank you.
Thank you, Dr. D. Thank you for your leadership. Now we will hear from Dr. Marcosi from University of Maryland Medical System. Doctor?
Good morning, Mayor Scott, Dr. DeRizza, and colleagues. Thank you, Mayor and Dr. DeRizza, for your comments, leadership, and efforts to keep the city of Baltimore healthy through this pandemic. I am humbly representing Dr. Mohan Santa, the President and CEO for the University of Maryland Medical System, who sends his sincere regrets that he is unable to attend this important update. Every winter, it is normal for hospitals to get much busier because, as we all move indoors and gather together, viruses like the flu find it easier to pass between us and make us sick. This year, though, things are worse, much worse, and we are feeling that impact here in Baltimore. A dramatic increase in COVID-19 inpatient cases from 91 on November 12th to 363 yesterday, realizing a 300% increase in just over 1 month, has occurred across the University of Maryland Medical System. 60 of those patients are receiving care in our 2 Baltimore City hospitals at the University of Maryland Medical Center's downtown and Midtown campuses. Unfortunately, we believe that things will continue to get more challenging, not less challenging, over the next few weeks, with not only COVID-19, but flu patients requiring care. In fact, this week, we anticipate surpassing the highest number of admitted COVID patients in our hospital system since the start of the pandemic. There is no question we are at a critical point, and the next several weeks will become increasingly challenging for us all. Hospitals remain open and ready to ensure every Marylander gets the critical medical care at this time during this new surge. But it means longer wait times in emergency departments as we focus on caring for the sickest of the patients first. So everyone needs to remember, please use emergency departments only for true emergencies. Marylanders should seek the right level of care at the right time in the right place. In other words, if you have the ability to see a primary care physician, urgent care center, or use telehealth for your non-emergent medical problem, please do so. For anyone seeking care in our emergency departments and hospitals, please be patient with staff. They are persevering despite incredible pressures, and they are the true heroes of this response. One key piece of information that Dr. DeRizza highlighted that I want to emphasize is many people aren't aware that this is not just a COVID-19 problem. This is much broader than a COVID-19 problem, as it is limiting our ability to care for many other illnesses and surgical problems too, from broken bones to asthma to heart problems. And this is absolutely an avoidable problem if we all take the right measures right now. The crisis we're seeing at UMS and at other hospitals is directly impacted by how we protect ourselves and each other. My request is, please help us. With the holidays, how we act individually right now will directly impact our ability to stay healthy and navigate these next few very challenging weeks. The main reason we are seeing this surge is that some of us are still not vaccinated. Without question, this is the main reason for the continued increase in COVID-19 hospitalizations. When we see a fellow Marylander in the ICU on a ventilator because they chose not to get vaccinated, it breaks our heart for them, their family, and their children. In December, 97% of COVID-19 hospitalizations within our health system had not received the 3 vaccinations needed to assure adequate protection. I want to be very clear on this. Hospitalizations from COVID-19 are largely now a preventable problem if you get fully vaccinated, which includes getting a booster. Understandably, some of us are concerned about the vaccine, and I am often asked, why can I still get infected after getting the vaccine? These vaccines were designed to save our lives and not allow us to get sick from COVID, but we can still get infected and we can still transmit this virus. This is an important point. These vaccines are safe and work to keep us from becoming sick and dying, but you can still transmit it to a family member or while you're out and about at the supermarket, at church, or at work. This is why we need to continue This is why we need to continue to own the responsibility to protect each other and ourselves even after vaccination. Simple things can slow the spread of COVID down, and it will help us get through these next few weeks. We need to all, number one, wear well-fitting, at least surgical masks over our nose and mouth. And if you're concerned, wear a higher grade KN95 or N95 mask. It will afford you greater protection. Number two, make sure you use COVID-19 at-home tests if you have had contact with anyone who is positive or you have cold symptoms. Number three, make sure that you stay home if you're sick. Please don't potentially infect others while you're at work. Number four, stay physically distanced from others in public spaces, as this virus moves very easily between us indoors. And last, avoid large gatherings, even over the holidays. I know this is difficult, but it is needed. As we all apply these measures Together, we will reduce the spread, and this crisis we'll be able to get through this crisis within the next few weeks. Finally, this holiday season, let's assure we connect with family and friends. If there is one thing this crisis has taught me, don't take anyone for granted. Right now, there is someone who needs to know that you care about them. Please reach out. Don't get too busy. Thank you, and my very best to you this holiday season. Mayor?
Thank you. Thank you very much, sir. Now we will hear from Kevin Sowers from Johns Hopkins.
Thank you, Mr. Mayor, and thank you, Dr. D, for your incredible support and ongoing support during this unprecedented time in our world. You know, while I'm president of Johns Hopkins Health System, today I'm going to speak to you as a nurse. I've been a nurse for 36 years, and I think the message is incredibly important beyond the leadership role that I hold at Johns Hopkins Health System. First of all, I want to thank the men and women who are serving in all of our hospitals for their dedication over the last 2 years. Clearly, they have given their lives both professionally and personally, and have withstood a challenging time in our country in terms of delivering care to COVID and non-COVID patients and the clinical needs of our community. So my hat's off to them. You know, we stand at a pivotal moment in the delivery of healthcare in the midst of our response to this virus and the surge. First of all, across this nation, hospitals are experiencing healthcare workforce shortages. And so one of the things that makes our response to this surge different is we don't have as many people on the front lines to deliver care. We've also seen an increase in our workforce testing positive at a high rate for Johns Hopkins Health System. We saw 23 employees testing positive a day. Now we're seeing a high of 63. So we're also seeing that compound with an impact on our workforce shortage, and also employees who are not able to come to work because they themselves have tested positive. We also are seeing clusters of that occur on our units where it's impacting our ability to deliver care in some of our specialty units. Once again, the spread is not occurring in our hospitals. Our employees are being infected literally in our communities as we're seeing the community spread. And so really we need to be thoughtful of that as we think about the impact on our hospitals and healthcare providers. You know, in Maryland, I think you heard the governor speak yesterday, we had the highest number of people test positive since the beginning of the pandemic. We've seen the hospitalizations in the state more than double over the last 3 weeks. At Johns Hopkins Hospital, we have seen that same increase that Marcos talked about in terms of the numbers of patients we see across our system. Currently, 70% of the patients within Johns Hopkins Hospital that are COVID positive are unvaccinated. 30% have been vaccinated, but they're 148 days on average out from their last vaccine. They have not received their booster. This data really highlights the importance of vaccination and receiving your booster. I would also say that as we, as an organization, actually sequence the virus, we have also seen an increase in the Omicron virus. Currently, as we see the sequencing taking place, about 52% are still Delta and 48% are actually Omicron. So, and that has been a significant increase over the last 2 weeks. So it does show you how quickly the new variant is spreading. Our response, as my peers stand behind me, and I know hospitals across Maryland are really making sure that we appropriately manage our elective surgeries and procedures as we begin to respond to the surges in our community. We are doing surge plans, but I would say once again, it's very different than the first surge because of the workforce shortages we're experiencing. The impact on our ERs, I'll give you a great for instance. Last Monday, one of our hospitals started with 12 ICU patients in the emergency room, and there were no ICU beds available within the state that we could transfer those patients. We worked for over 20 hours trying to get those patients to appropriate levels of care. So it is a real impact, as Marco said, on our emergency room and our ICUs in the higher levels of care. So I come to you today to just ask for your help. We have always been here and will continue to be here to care for you and your loved ones. It's the unvaccinated population that is overwhelming our hospitals and health systems. In a time when we do not have the same number of people and resources in place because of the implications of what I spoke to in terms of workforce shortages and our own people becoming infected. Please go and get vaccinated and get your booster and help us save lives. This holiday season, please make sure that while you're with your loved ones, you appropriately mask, social distance, and hand washing. And in this holiday season, may you find peace, joy, and hope. And I also wish that you and your loved ones find the gift of health. And to do that, it's going to require each of us getting vaccinated. The people working in our hospitals and health systems want to be able to be there to help meet the ongoing healthcare needs of our community. I ask you to please be patient and kind to our providers as we try to respond to this surge. They have been working tirelessly over the last 2 years to save lives, and we should be grateful for the contributions they continue to make. Thank you.
Thank you, Kevin. We'll hear now from Brad Chambers from ESTO.
Thank you, Mr. Mayor. Thank you, Dr. D. Pardon my voice. My colleagues have summed it up very well. Today is really about reaching out to the community. We need your help. We need your assistance. We need to protect the welfare of the citizens of Baltimore. Please get vaccinated and urge those that haven't been vaccinated to reach out to us. Our hospitals are overcrowded, but by working together, we can get through this. Please, please, listen to the words that were spoken today by the mayor, by the health commissioner, and by my colleagues. We need everyone to be working together and supporting the hospitals over the coming weeks. We think that we still have a couple of weeks ahead of us as we go through this surge. Get vaccinated, get boosted, but more importantly, stay safe. Thank you.
Thank you, sir. And last but certainly not least, we'll hear from Rebecca Altman from LifeBridge.
Good morning. Thank you, Mr. Mayor. Thank you, Dr. Duraza, for all your support and your collaboration. Thank you. I'm Rebecca Altman, Vice President of Operations and Chief Integration Officer for LifeBridge Health. I also oversee the operations of Sinai and Grace Medical Center in West Baltimore. As you heard from our fellow health systems, our hospitals are extremely busy and nearly full to capacity. Our ICUs at our hospital at Sinai and hospitals across the state are at capacity. Our emergency departments, both at Sinai, Grace Medical Center, and as you've heard from our colleagues across the state, are full. Last month alone, in 1 month at Sinai, our COVID admissions rose 825%. Yesterday alone, our admissions for COVID patients, 27.5% in 1 day. Our healthcare workers are caring for COVID-19 patients with the same level of compassion as they did from the outset, and they are exhausted. They tell us that they've seen so much death and sadness over the last year, more than they have seen in their entire careers as healthcare workers. We need your help as a community members to be vaccinated, to ensure that our hospitals can continue to provide the care for our COVID patients and those facing other serious illnesses. Remember to use the emergency room for emergencies only. Do not, and please do not, come to the emergency room for a COVID test. We need to do everything to keep everyone safe and well. The overwhelming majority of our sickest patients are unvaccinated. One patient told his care team before he passed away that he didn't believe in science and he never got vaccinated. The virus does not care if you do not believe in the virus or in science, and it doesn't care that the holidays are with us now. We implore you, as you celebrate together the holidays, that you mask, you socially distance, and you consider what you do as a family gathering. We know that the vaccine and booster are your best defense against serious illness of COVID-19. Our caregivers are struggling because they want to help people. But as one nurse said, it's hard to take care of people who don't take care of themselves. Since the beginning of the pandemic, our healthcare providers have been seen as heroes. Now we need the community to be our heroes to limit the spread of this virus. Get vaccinated, get boosted, socially distance, gather responsibility for the holidays, and wash your hands. Please be there for our healthcare workers so we can be there for you. Thank you.
Thank you all very much, and thank you for your work, your guidance, and your dedication to keeping Baltimoreans healthy and safe. And again, thank you to your workers who have put themselves at risk each and every day during this pandemic and have come to work and been able to be in this fight with COVID because of them and the work that they do. But the last message before we take questions is very simple. We know how to prevent people from getting very sick or dying. That's to get vaccinated. You heard it here today. You are 14 times more likely to die from COVID if you contract COVID if you are not vaccinated. The overwhelming majority of the people who are in our hospitals with COVID are unvaccinated. Please get yourself vaccinated and boosted. Get your children vaccinated so that we can be together, be healthy, and finally continue to battle and win this fight against COVID. And with that, we'll take a few questions. Oh, 1 second, man. Sorry about that, Abby. Try it now.
Are you considering reinstituting any restrictions, and how worried are you about what January is going to look like?
Well, I'm very worried. That's why we're here today, and I'm worried. Our hospital partners are worried. You often hear me say that I am the luckiest mayor in the world because I have 11 of the leading health institutions and their leaders in the world who are here and at my disposal to advise me. I'm extremely worried because we're having so many people in our hospitals. As of right now, we know what we need to do, and that's to get people vaccinated. We know, you saw, we did put a restriction in today. That is the only one as of right now that we're considering. We are, as you heard me, have directed Dr. D to look at a vaccine passport because this is a simple thing now. It's about people getting vaccinated so that we can keep them healthy.
Then I have a question for Dr. Duraza. You're talking a lot about getting people tested before the holidays, but yesterday I was out at the Pratt Libraries, I was out at the testing site at Village Baptist Church. I mean, so many people are trying to get tested for that little peace of mind. Is the city trying to do anything independently of the state to secure rapid tests or testing? Can you talk about any other efforts?
I'll start by saying yes, Dr. D. We are looking how to procure more of the at-home tests for folks outside of what the state is allowing us, and then I will allow her to finish. Thank you.
No, I think the mayor covered it. We've been looking to procure additional testing sites. I mean, again, this is a jurisdiction-wide, statewide challenge right now. We're limited in supply, but certainly are looking to procure it and have already, again, as I mentioned, expanded testing to an additional day and are looking at other ways to expand testing.
Ma'am?
Hi, Mayor. Twice now you've mentioned the possibility of bringing in the vaccine passport. I was just curious what that looks like for you and how soon we can expect something implemented.
You faded out at the end there.
I was just asking how soon you expect something implemented and what that looks like for you.
Well, we don't know yet. So as I said today, I've asked Dr. D to put together a group of folks, including business owners, to talk about what that would look like for us, looking at the best practices from around the country, how it has been working in some places or what hasn't been working, and we'll get back to you guys with that in the future. Sir?
It's a general question. Everybody around us has a different mask on. Earlier, the doctor recommended that we need the N95. So are our cloth masks, the pink masks, are they not working? So what's the recommendation?
So I'll let the medical experts go into the details. We know that the medical masks are the most prevent the most. We know that, but we want folks to wear any mask, right? We have to also understand that some communities and some people in Baltimore may not have the access to some of the masks, and we're going to continue to be able to try to make sure that people have that access. We want people to wear masks. Obviously, the medical masks are going to be protect you the most, but just wear a mask over your face.
I was wondering if a doctor could speak to booster shots. A lot of people are talking about getting them, but we're 3 days away from Christmas. So if someone were to get their booster today, is it still the full 2 weeks of the vaccine dose to be effective, or does it build on quicker because they have those 2 doses?
No, it'll still be the 2 weeks following, but again, I mean, we have Christmas coming up. We have, additional holidays post Christmas, and so I mean, the sooner you get it, the sooner you'll be protected, even if it is 2 weeks from today.
Anybody else? Thank you, everybody.